Hi, welcome to Combating the Opioid Crisis, developing effective opioid misuse prevention campaigns. My name is Jeff Jordan, President and Executive Creative Director at Rescue, the behavior change agency. We work exclusively on changing health behaviors, and today we're going to talk about how we can apply our experience from over the past 17 years to the opioid crisis. But before we jump into developing opioid misuse prevention campaigns, we have to admit a hard truth to ourselves, and that is that most health communications campaigns fail to actually change health behaviors. There are so many PSAs and other kind of public service announcements that don't actually end up moving the needle when the campaign is over. So, as we begin our work in opioid misuse prevention, what we have to ask ourselves is, how do we ensure that opioid misuse prevention campaigns are actually effective? Because the truth is that just putting a commercial on TV doesn't actually guarantee that we're going to change health behaviors. So, to understand what works and what doesn't work, let's take a step back all the way to understanding exactly what behavior change marketing actually is. A lot of people believe that health marketing is simply putting a commercial on TV or some sort of PSA on TV and expecting it to work. But in reality, behavior change marketing is not simply just about advertising. It works when we actually change something that specifically affects behavior. So what does that mean? Well, there's a few different things that we can change. So when we think about behavior change marketing, a lot of times we think about changing knowledge, helping someone understand why a behavior is risky, or maybe helping them know how to engage in a healthier behavior. We also can change the environment, change what's around you, such as making the stairs more accessible, or adding bike lanes, or making certain products more expensive to buy. All of these kind of environmental changes also end up changing people's behaviors. Or the third way that we can cause change with behavior change marketing is changing norms. And changing norms is when we talk about making a behavior less socially acceptable, or making a healthy behavior more socially acceptable. So when we look at opioid misuse prevention campaigns, we can actually do work in all three of these areas. When we talk about changing knowledge, we're talking about increasing understanding of risk for addiction, increasing knowledge of alternative options for pain, increasing the perception of risk to oneself, and recreational use risks, including mixing substances with alcohol and how dangerous that actually is. When we talk about changing the environment, we could be doing things like prescription limits, safe storage and disposal, reducing illicit drug supply, and law enforcement. And more so, when we're talking about changing norms, we can talk about reducing the social acceptability of recreational opioid use, reducing the acceptability of sharing pills with friends, and increasing the social norm of reducing risk for addiction. There's a lot we can do in opioid misuse prevention, but what we're going to focus on today is changing knowledge. This is the starting point for a lot of opioid misuse prevention campaigns. It's just getting the word out, right? How many times have we heard that? Someone will say, well, we just need to get the word out about how risky and dangerous these drugs are. And it's based on that notion, based on that need to just tell people what's going on, that has led to a lot of the first round of opioid misuse prevention campaigns. Now, as we scour the country and look at what started to come out, we see a really clear trend. And that is, if you take this, you will die. And that's an important message. That is what is literally happening to the 50, 60,000 people a year that are unfortunately dying from an opioid misuse or heroin use. But the challenge is telling someone that they're going to die from opioid misuse the way to actually get them to change their behavior. Because all of these campaigns are assuming that it is. Well, let's think through that a little bit. If you're someone who is at risk of using opioids, and you hear this message that you can die at any minute from an opioid overdose, the first thing we're going to ask yourself is, well, do you even know what an opioid is, right? Then we want to know, are my prescriptions actually opioids? Right? So maybe I'm taking something and I don't even know that it is an opioid. They're also going to want to know, well, what are opioids for? They're for pain. How do they work? What does it actually do to your mind and body, right? So this is kind of a basic level of knowledge that is necessary for people to understand the message that opioids are risky. But it doesn't just stop there. Then we're going to start asking questions like, how does opioid addiction actually work? How does opioid overdose work, right? If I've been taking this pill every day or multiple times a day for all this time, what actually is an overdose? And how can something that I get from my doctor be so dangerous, right? That's a huge barrier to understand that, well, I was prescribed this drug, or someone I know was prescribed this drug, so how can that actually cause an overdose? And then even after that, we're going to ask other questions like, well, I'm not an addict, so this isn't relevant to me, right? If we hear about people dying from a certain drug, we immediately kind of imagine the stereotype and the stigma that's associated with drug overdose and tell ourselves that that can't possibly be me. We're also going to ask things like, well, if I take my pills for pain and not recreationally, then this message must not apply for me. People who are taking medicine don't overdose, right? So all of these pieces of information have to be understood before someone can understand the main message, which is that you can die at any minute from an opioid overdose. Now, if you're someone that knows all of this information, seeing a billboard or a TV ad that tells you how possible opioid overdose is could work. But if you're someone that doesn't have any of this knowledge and all you hear is that you could die at any minute from an opioid overdose, well, that's going to make it a lot harder for you to understand that message. In fact, without that foundation, the message possibly is just going to fall flat. So unfortunately, what happens a lot is that we mistake changing knowledge for increasing risk awareness. We assume that all we have to do is tell people how risky something is, and that just that one piece of knowledge is going to be enough to change their behavior. But in reality, what we have to do is we have to deliver the specific information that will motivate a certain person. And that means that we have to understand what knowledge our audience currently has and make sure that the commercials and posters and billboards and websites, whatever it is that we're making, make sure that what we're making actually is relevant to the current base knowledge that our audience has. So let me give you an example. What happens is when we look at ads and we look at commercials and we process information, we look at that through our own lens of personal experience, knowledge, attitudes, and beliefs. Right? So we've got our kind of many of the existing messages, and there's many more, right? There's a lot of messages that are talking about overdose and the risk of death. We're going to look at those and we're going to process those messages through our existing knowledge. So if I'm someone that knows what opioids are, knows how addiction works, believes that I could be addicted, and that prescriptions can be dangerous, then I'm primed to believe a message that opioids could kill me. And in that case, with all that existing base knowledge, I would process those messages and say, this is a real and relevant threat to me that I should take into consideration. But if I don't have any of those pieces of information, if I don't believe this is relevant, if I don't even know what opioids are, well then I'm not really going to be able to process that information, right? Think about how many messages you see every day that are not necessarily for you, that your brain just automatically ignores. Well, that's what happens when a message is delivered to us that is not based on our interests, our knowledge, that's just not relevant to us. So when we're talking about opioid misuse prevention, we need to start by asking who is our audience and what message do they need to hear in order to be able to change, to motivate their behaviors to change. So first, in order to understand who our audience could possibly be, we have to recognize that not everyone is the same. Right? Not everyone's going to have the same level of knowledge, and not everyone's going to be using opioids for the same reasons. For example, some might be using it as a prescription, some might be using it as pain management, some might be using it recreationally. So in order to kind of get a sense of where different people are and what knowledge they have, we have to segment our audience. So segmentation is a concept that comes from the commercial world, and it's the process of classifying a market into distinct segments that behave in similar ways or have similar needs. Now, the reason that we do this in marketing is because segmentation creates these kind of clear and distinct values, right? An understanding of here's one group and they believe this, they have this knowledge, and here's another group and they have different knowledge and have different beliefs. So when we do this kind of segmentation within opioid misuse prevention, there's a lot of ways we can do it. But one way that we can do it is simply by looking at the current relationship that different people have with the drug. Right? So here's 6 different groups of people just looking at their relationship based on opioids. So all 6 of these groups are going to have different messages and different kind of questions and base states of knowledge. For example, the first group might be a group that is going to want to get involved in community activities and policy change. So they may be asking like, how do I protect my community and how can I cause policy change in my community about opioids? But then the next group, the group that doesn't currently use yet but is open to, might be asking questions like, what do I do if I need pain management? How can I make a difference in my community? What medications are actually opioids? Right? So they're going to have a lot more elementary questions to answer. Then we have the relieving acute pain group. And this group is going to be asking questions like, how much can I take safely and for how long? What if I like it? What do I do with the leftovers? what's the difference between the opioid epidemic and my medical need, right? I've been prescribed this drug that I'm hearing is a really bad drug. How do I reconcile those two pieces of information? That's going to be really important for someone that recently got a prescription. Now you have the group that's managing chronic pain. This group's going to have a lot of really serious questions because this is working for them. This drug maybe is providing relief that no other drug could. And so they're going to have questions like, where would I get these and when I need them? If you're changing policies or if you're changing education of doctors. I'm in real pain. What else can I use? Right? We can't just tell someone not to use something that they're using for a specific reason and not give them an alternative. What's wrong with my pills? They help me. Right? How frustrating, imagine how frustrating it would feel for someone to be telling you that your pills are bad when you've had years of experience of those pills actually being helpful in your life. Do I actually need them? What are safer alternatives? These are all just the kinds of questions that this audience would be asking. Next, our addicted audience would be asking questions like, I think I'm addicted, what do I do? I'm in control of my use. I don't think I'm addicted. Why do you think I'm addicted, right? So kind of some knowledge around what addiction actually means. What are safer alternatives? Where can I get judgment-free help? I'm not a drug addict, so why would I seek help? So this group, there's a lot of stigma around the idea of what it means to be an addict and what it means to be addicted. And a lot of people who may be addicted can't come to terms with that because of those stigmas. Right? So this group's got a whole different set of challenges for us to work through. And then finally, the group that's getting high, the recreational users, well, they're asking a whole different set of questions. They're looking at, well, what am I taking exactly? This drug was given to me by a friend. They told me that it was someone's prescription that they knew. So is this dangerous? Can I mix this with other substances? What's the difference between the opioid epidemic and my use, which is a very different kind of use? And I've taken this before, so I guess I'm fine, right? So if they have previous experience and they didn't experience any kind of addiction immediately or any kind of negative health consequence, we have to explain to them why a negative health consequence could be possible next time that they use. So the point is that each of these different audiences has a whole different set of questions and pieces of information that they're going to want to know in order to cause change. So how do we make sense of all of this and how do we kind of put this all together? Well, one way to look at this is through Rescue's decision blocks framework. So what this is just a kind of strategic framework that we use to help us put together health communications campaigns that focus on understanding who is our audience and what are we changing that's going to motivate that audience to cause change. So we have 4 different kind of levels to our decision blocks, to our pyramid of change here. The first level is what we call foundational knowledge. This is the level that everyone needs to know in order to know what the heck we're talking about. So here we're looking at what is the behavior, what does it include, and how does it affect you? The next layer, once I have that foundational knowledge, then we move into an understanding of risk. And those are questions like, what are the potential health consequences of the behavior? How do I know that they happen? What's the science behind them? How's it working in my body? These are all just kind of some of the basic questions that people want to understand the risks that they're engaged in. After that, we have what's called perceived relevance. And perceived relevance is understanding whether these risks that I just learned about could actually happen to me. Right? So this is where we get hung up a lot of times when people understand that there's something risky, but they don't think it's relevant to them. They don't think they could be exposed because maybe they think it's for someone who takes a lot more of the drug or someone who is much more careless with their behaviors. And so this is where we have to answer questions like, are the health consequences something that you believe could happen to you? And if a person doesn't think that those health consequences are possible for them, then they're simply exempting themselves from all these risk messages and saying, oh, that's for someone else. So we can't ignore that belief. And then finally, at the top of the pyramid, we have what we call urgency. And urgency takes a piece of knowledge where someone says, yeah, I could be at risk in the future, and tells them, no, you are at risk right now, and you have to take action right now. And so a lot of times you see health consequence information that is focused on this urgency factor because us in public health feel so much urgency to cause change, but the audience may not be there yet. The audience may not have the perceived relevance of risk and an understanding of risk in order to process that urgency that we're trying to communicate. Make sense? Now, one more layer on top of all of this, and that's the relevance and source. So as we message on each of these layers, we also have to make sure that the message is actually coming from a trusted source. So what does that mean is, well, if I'm a recreational user, I need to know that whoever's talking understands recreational use. If I'm someone that's in chronic pain, I need to understand that whoever's talking is sympathetic and understands my chronic pain. Right? So we're not just talking about putting a doctor in every commercial, we're talking about putting someone that is going to be trustworthy and relevant to the specific audience we're talking to, and that may be a different person for different groups of people. And that's what makes all of these messages come together and actually work more effectively. So let's look at this from an opioids perspective. So on the foundational knowledge level, what we have is we have things like opioids include prescription painkillers like Oxy and Percocet, right? So we got to let them know what drugs we're talking about, what their names are, because people don't call them opioids at the pharmacy. We also have to say that what they do. So they manage pain by blocking pain receptors, but they don't actually fix physical pain. Even though they come from a doctor, they carry significant risks, right? So here, as you can see, we're just establishing that foundation of knowledge. Then we have to start talking about risk. And so some of the risks we might talk about is that opioids have addictive qualities, that addiction can happen quickly, that the drugs don't actually heal pain, they just mask it, often requiring shorter dosages over time, stronger dosages over time, and that there are safer ways to manage the pain. Then we talk about perceived relevance. And perceived relevance is that even though these drugs come from a doctor, they're very powerful. The chemical addiction is more powerful than someone's willpower. And that even if they just have a prescription, they are at risk for addiction. So really trying to kind of counteract some of those false assumptions that people make about why they are exempt from this risk that they've heard, we have to tackle them now when it comes to opioids. And then lastly, for urgency, we're talking about that opioids chemically are very similar to heroin, that someone can overdose very easily, what that overdose actually looks like, right? That it's not just swallowing a whole bottle of pills, that it comes from over time a tolerance being developed, or it comes from possibly mixing opioids with alcohol, or starting to use heroin, etc. And that using opioids, especially not as prescribed, can kill someone at any time. That this is not something that it's this big dramatic event as it's depicted in a movie. It is something that could happen to someone who is involved in kind of ongoing use. And so all of these pieces of information have to be put together in a logical and relevant way for each audience in order for them to be motivated to change. Now, we can get to this ultimate consequence that we want, which is for people not to misuse this drug and not overdose. But in order to get them there, we have to bring our audience along. That means that we can't just give them the message we want, the urgency that we have about overdoses and about dying. Now, one example of a campaign that's doing this is called Over the Dose, a campaign that we developed for the Vermont Department of Health. And this campaign is focused on recreational use amongst young adults, and it's focused on those first two layers to begin establishing that required information. So the first layer, foundational knowledge, helping the audience understand what opioids actually are, what their drug names are, what their street names are, what they actually do, what their uses are for, etc. And we're also helping them understand the risk, right? So we're building this knowledge to change their behavior. Here we're talking about how opioids are addictive, how the addiction can actually happen quickly, that drugs don't heal their pain, etc. And the focus here is to really start to build the foundation of understanding of what the drugs are so that we can start to deliver more high consequence information. So you see that on here, we're not yet talking about overdose. One of the first components is a commercial that's currently running online. Let me show you what that commercial looks like.
The human brain can tell the difference between danger and safety, but there's something your brain can't differentiate: prescription opioids and heroin. You see, everyone's brain has receptors that regulate both pain and emotion. Heroin and prescription opioids both bind to these receptors, causing the same kind of dependency and addiction because chemically, they're almost exactly the same. So, no matter why you use them, now your brain knows. Prescription opioids are seriously dangerous drugs. Visit overthedosevt.com to learn more.
All right, so what you just saw there was an introduction to kind of what opioids are and how they actually work in your brain. A lot of times, we throw out that opioids are the same as heroin, and people don't really understand what that means. They know what their image of heroin is in their mind, and they see opioids. Opioids are a pill, heroin comes with a needle, and it just doesn't register. And so the first goal of this campaign was to make sense of that big fact that everyone's talking about. But that's not all. What the campaign's really looking to work on right now is kind of making sure that there's engagement that's going to retain them, create engagement, and drive traffic to the website. So here's an example of some of the social media and digital posts of the campaign. So first you see some of the social posts. You have a post talking about what kind of drugs opioids are. And so if you were to click on that post, you would go somewhere that would explain all the different brands and street names. And then other doses that talk about other posts that talk about exactly how addiction to opioids happens over time. And you see kind of the moving digital ads. All of this work, the social posts, the digital video, and the digital ads all drive to the website. And so the website is designed to be an interactive experience that allows a user to learn about opioids at their own pace and process the information using this kind of interactive module. So here you can see someone actually clicking in order to get more information. So as they play with the different tools, different things happen. Here we're looking at trying to understand a little bit more about addiction. And then the next one shows us a little bit more about how alcohol and opioids mix together and what that actually does to your body and why it is that the combination could actually shut down your body while you're asleep. And then finally, we look at some consequences, how opioids are affecting real people's lives. Everything from addiction to actual criminal consequences to possible overdose and death. And so we've been very careful not to kind of focus on scare tactics and kind of overwhelm people, but instead have focused on the bits of information that are going to build together in order for them to build a comprehensive understanding of the drug and its risks so that they can make their decision. And what we've seen so far in just this short time that this campaign has been up has been great success. Overall, on the website, we have 45% of visitors who begin the interactive process, actually going all the way to the end to the voting stage and finishing that, which is a huge response rate for any kind of public health information campaign. We're also seeing an average of 4 minutes spent on the site, which is 3 times more than the industry benchmark for this kind of campaign. Next, we're also seeing that on social, there's a 5 times engagement rate than the normal industry benchmark for these kinds of campaigns. So what we're seeing is a tremendous amount of engagement with people that are appreciating the knowledge and are interested in learning more, clicking through and going to the website. And on digital, we're seeing a similar success. 2 times the industry benchmark are clicking through in the ads and going through the website. So what does this mean? It means that this campaign that's specifically designed not to scare the audience, but to allow them to go through the pieces of information that are necessary to fully understand the complex issue of opioid misuse is performing as intended. In fact, it's overperforming based on our expectations. And so this is just one way, and this is just one audience looking at recreational opioid users. But the bottom line and the message that we're trying to convey to you today is making sure that we develop effective opioid misuse prevention messages. Over the Dose is just one campaign for one audience, recreational users, and there's many more audiences that need effective messaging to prevent opioid misuse. To develop these effective messages, you just have to remember 3 things. First, meet your audience where they're at. Don't assume that your audience knows what you're talking about. Do the research and understand what is their current base knowledge and which pieces of information will actually drive them to change. Then, tailor your messaging to give relevant and timely content. Make sure that your content is driven by a source that they're going to trust and that the information is actually something that they can use in their current life right now. And then finally, design the content for interaction and engagement. People learn in different ways, and just telling them like, hey, you're gonna die if you keep doing this is not necessarily going to move them the way that interactive content that's actually helping them understand the problem is going to motivate them. So really focus on what is it that your audience needs to learn, how can you tailor it to them, and how can you make it so that they can actually interact with this information rather than just trying to lecture them. And when the message is complex, break it down into more digestible blocks, which is essentially what the decision blocks framework is. It's a way to look at all the pieces of information that someone needs in order to make a behavioral decision and breaking them down into pieces so that we understand where our audience is and what the next piece of information that they need is. Bottom line, we can stop the opioid epidemic. We've got resources being mobilized. We've got professionals across the country that are working on this. All we have to do now is make sure that we're developing our messages for our audience and not simply based on what we think they need to hear about. Let's focus on who our audience is, where they're at with their challenges, and what piece of information is actually going to move them to change their behavior. And with that, we'll start to turn the tide. So thank you very much for joining us. Thanks for watching this video. And if you want to learn more about rescue strategies and some of our other campaigns, please check out our YouTube channel at youtube.com/rescueagency. Thank you.